You hear a physician talking to a group of trainee doctors. Now, read the question.
Honeybees have barbed stingers that are left behind in the person's skin after the initial sting. If the stinger is removed by pinching the stinger, more venom is actually injected, so it's better to remove the stinger by gently lifting it using a pair of tweezers to remove it from the skin. Generally, honeybees aren't aggressive and only sting in self-defense. However, in some cases, a person will disrupt a hive or swarm of bees and get stung multiple times. If a person gets stung more than a dozen times, the accumulation of venom may induce a toxic reaction and make them feel quite sick. And multiple stings can be a medical emergency, especially in children, older adults, and people who have heart or breathing problems. So make sure to check with the patient and be aware of the signs of multiple stings.
Listening Part B. You hear two dentists discussing a patient. Now read the question.
I've just seen Mr. Butler, one of your regular patients. He's been in some pain recently.
Right. I've been fully booked for the past few weeks, and he told reception he couldn't wait any longer. He's had chronic periodontitis for some time now, but I gather it's worse.
Yes, I provided thorough curative treatment in all quadrants today, but his gums were in such poor condition and there was severe mobility in his lower right first and second molars, so I had to extract them. I've scheduled him for implant surgery, but I'm worried about his broader health issues and whether or not he's been taking biphosphonates. I couldn't find any information in his records about it.
There isn't any, no. You may have to contact his GP.
Okay, I certainly want to reduce the risk of any osteonecrosis after surgery. Listening Part B. You hear an optometrist giving a presentation to a group of teachers. Now, read the question.
About 1 in 12 boys is colourblind, and 1 in every 400 girls. So in each school class there are likely to be at least 1 or 2 students who are colourblind. Because they are colourblind from birth, most people don't know that they're colourblind. They don't know that other people see things differently. Being colourblind can cause difficulties when it's important to be able to see lots of colours, such as on a computer screen or in art classes. Boys should have their colour vision tested when other people in the family are known to have colour vision problems. If people on both sides of the family are known to have colour vision problems, then girls should also be tested. Colour vision testing can be done by optometrists using specially designed charts. Some school health services and some doctors will also be able to test colour vision.
Listening Part B. You hear a radiographer talking to a patient about their CTC examination. Now, read the question.
Okay, so your appointment's scheduled for 8:30 next Tuesday morning.
That's great. Thanks for organising that.
No problem. Now, the main purpose of the CTC examination is to look for abnormalities or polyps in the large bowel with the use of a CT scanner. So that means 3 days before the test, you'll need to start eating a low-fibre diet, and then 24 hours before the test, you'll be drinking clear fluids and you'll need to abstain from alcohol. Then on the evening before the test, you'll need to take laxatives as prescribed by your doctor with several glasses of water. You also can't have any breakfast on the morning of the test, and we'll need you to be self-administering some suppositories at that time. But all of this information is set out in the letter. If you've got any questions or concerns about it, make sure you contact either myself or your doctor.
Okay, thanks.
Listening Part B. You hear a physiotherapist speaking to a support group for Parkinson's disease. Now read the question.
The physiotherapist's aim is to maximise the patient's functional ability and quality of life. Physiotherapy can help alleviate symptoms like tremors, rigidity, slowness of movement, and impaired balance, which can cause abnormal gait and posture. It can also help with cramps and pain in the muscles, and even help patients who experience reduced fine motor coordination. Physiotherapists use physical treatments such as exercise to prevent or reduce stiffness in the joints and to restore muscle strength and mobility. As well as this, physiotherapists can supervise the patient's exercises to help maintain their posture and balance and advise the patient about ways of preventing or reducing the risk of falls. Physiotherapists use other treatments such as heat and cold or electrical equipment like ultrasound to help relieve pain patients may have. They can also advise or train parents and guardians of patients suffering from Parkinson's disease in safe and appropriate ways of helping them with mobility problems.
Listening Part B. You hear an oncologist talking with a patient about their test results. Now, read the question.
Well, I'm happy to report that the colonoscopy has found no evidence of cancer.
Are you sure, Doctor?
I know you're worried because your father had bowel cancer, but your tests came back negative, so that's a good result for you. And let me reassure you, we can see cancer if it's present in the colon in more than 90% of cases. So we miss very few early stage cases.
That's a relief, Doctor. It really is. But then we still don't know why I'm experiencing these abdominal pains.
Actually, we do. We discovered that you have something called diverticular disease. Have you ever heard of this condition?
No, I haven't, but it sounds pretty serious.
Well, if we follow the proper management, it doesn't have to be so serious. Let me tell you a little bit more about it.